You're here in special session,
Yes,
which I
yes.
don't think many people expected. Did you expect it?
Well, I did expect us to have a special session after I figured out we may have an impasse over, healthcare and some of the budget issues. So I would say probably by week two, I figured we'd be coming back.
To the uninitiated, people outside of Tallahassee who follow this process so closely, how do you explain to someone what did happen that led to people having to say, look, we got to have a special session. We can't get it done inside the normal 60-day time frame.
Well, I think the first thing you have to understand is that we're constitutionally only supposed to do one thing up here, and that is to pass the budget. And we didn't do that. So that's the first off. If we didn't pass a budget through both houses that is the same, then you know that we've got to come back because we have to do it, and it has to be a balanced budget. We're not the federal government. We can't borrow money from anyone. We have to pass a balanced budget by the end of the fiscal year. So we knew we had to come back to do that. Now, why we didn't pass a balanced budget is kind of the question, I guess. And I would say our big issue is on healthcare, and it's on whether we expand coverage to 850,000 Floridians, and also if the federal government is going to give us the money that they traditionally had been giving us since Governor Bush was here, called the low-income pool money, to help hospitals with exactly that. People who are uninsured that come and show up to a hospital and need care.
And that's separate from Medicaid.
Right, right. That is separate from it. But what happens is, and I think how it's related, because I think there's been a misnomer out there that they're not the same, they're not related. Well, truthfully, they are. And the LIP came about because we had such a large gap of people who weren't receiving health, that didn't have health insurance. Now, this was, of course, before Obamacare, but the concept of a way to help pay for people who don't have health insurance, that's what LIP was, and that's kind of what Medicaid expansion is. So in that way, they're related. So if you expand Medicaid coverage to everyone, then, or that 850,000 people, then the hospitals won't be burdened with taking care of so many people that walk through their doors.